Hi, my name's Debbie. I'm a mother of 3, and after having the 3 children and breastfeeding, I lost some volume, so I had breast augmentation done by another doctor and just wasn't real happy with the results of it. So came in here hoping that Dr. Ptak could correct the last procedure.
Well, first of all, I really enjoyed meeting Debbie, and I think she'd be a great patient. I do think she's got a very common problem. It's a fairly straightforward problem that we do see pretty often these days. And I think it's one of the things that women really need to be aware of and just have in the back of their mind that breast implant surgery, even though there's a very low possibility of any complications, do have some risks, and this is one of the long-term risks that is known, and I think it is somewhat preventable, although I think it can happen really to anyone. So what it really does is it begs the whole argument for conservative breast augmentation, that large implants, especially in a relatively thin woman, is just not very practical. It's not actually even medically very sound. So it can stretch the tissue that is holding the implant to the point where it just stretches beyond the ability to hold that weight over a long period of time. So this happens.
I say it's important to do your homework, and you can ask a friend who did their surgery, and it may have worked well for them, but there's other circumstances, situations that need to keep in mind when a doctor is doing plastic surgery. So it's important to make sure that the doctor is an aesthetic plastic surgeon.
If you're seeking either a primary procedure or a secondary procedure, I think it is really important first to do your homework, to check certification, to check complications, to talk to other patients and other physicians who may know the doctor's work. I think it's very important to have multiple consultations so that the patient becomes educated to know and hear at least the same story once or twice, because if they're getting all different stories, then they really need to go back to square one. But whenever you're doing revision surgery, I think it's really, really important to have someone who's got the experience to be able to say, here's option A, B, and C, but I can tell you A and B aren't going to work. That you really need to go to option C, even though it may cost a little bit more, you're going to be way ahead in the long run, because you just can't afford to do these procedures multiple times, and she's already experienced that. She's had 3 operations on one side, and now she needs to have a total corrective procedure on both sides. Really that just shouldn't happen with more than a 1 or 2% chance of it happening. So I think it just really begs that you need to do it right the first time, be conservative, choose the right surgeon.
If I had to choose one, I was very impressed by the consultation and his level of knowledge, and he would be the one that I would want.